Everything about the healthcare CEO assassination disgusts me. Most of all, that so many were okay with it. And the reason why, because the system sucks, because the system is making them sick. It's killing them in some cases, bankrupting them in many cases. Now, at that time, leaders gave this perverse reaction to an assassination the lip service. Well, we get it. We get why they're... But then it faded, and then we had a shutdown about really one of the easiest aspects of our healthcare problem, which is the ACA subsidies. Affects about 22, 25 million people, but that's just about how much tax money you want to give to helping people pay because the prices are too high. And even on that, we shut down the government. So many people suffered so much for so long, but it's amounted to nothing. Now, today, a group of bipartisan House members put out their own plan to keep the ACA subsidies up for about 2 years. Good for them. But again, that is one aspect, one symptom. What is the disease and what is the remedy? Dr. Bill Hennessy, self-described whistleblower on healthcare costs. I took a look at what he's been putting out, and it jibes with a lot of what I hear from experts in the arena. And I want politicians and you to hear what he has to say. Doc, thank you for joining us.
Glad to be here. Good evening.
So, in your study of the system, both as a practitioner and understanding the pay side, why are the costs increasing the way they are?
Because the prices are held secret for this $5 trillion industry. There can be no capitalism and competition when the prices are hidden. And there's 5 enemies to affordable healthcare costs. Their names are hospitals, Blue Shield, United, Cigna, and Aetna. They collude to keep the pricing secret, and they're partners in crime in driving up the costs.
And they get to keep it quiet because they stuff so much money in politicians' pockets. They're the #1 lobbying entity in this country, and they employ so many people. So you got to be careful about what you'll lose in your district if they're going to cut jobs because you make them cut costs. So now what we're hearing is, no. It's the ACA. The ACA, Obamacare, is why prices are so high. What do you make of that?
Well, I think there's a lot of truth to that. I still want to give you a gold nugget of how it can be better for a lot of people that are blue-collar working America. There's 2 big issues that are adverse to America having affordable care in the ACA. One is called the medical loss ratio, the MLR. You have to spend 80% of your insurance money on care. That means of the other 20% comes your profit and administration fees. So I'll ask you this: you better off having $100 billion in revenue or $500 billion in revenue when your goal is to maximize that 20% for yourself? It's a perverse financial misalignment for incentive. The other one is before 2010, we all accepted it and it was standard. Your cap was $1 million of care of health insurance. That, even in today's world, should get you plenty of care for anything you need. Mm-hmm. So when they said, well, we're just going to remove that care, you could die or be sick for $5 or $15 million. Now the multi-million-dollar claims came through because hospitals saw the opportunity and they capitalized on it.
So what would be the biggest thing politicians could do to bring down prices in the most places for the most people?
Well, let's talk the ACA first, because the subsidies. 99 out of 100 people only need care. They don't get hospitalized. Okay, so they are post-Obamacare, working age 27, pre-Medicare 64, 27. 1 in 100 to 1 in 120 needs insurance and gets hospitalized. That means over 99% just need care. They need a doctor visit, blood work, mammogram, screening GI scope, routine care. Just imagine, instead of giving Blue Shield $400 a month for a subsidy, times 12 months, or nearly $5,000 for every person, and you gave that to every person. everybody get the care they need. By the way, it's the taxpayers' money, so I think the money should go back to the taxpayers. And there's ways to do that, to have them only spend the money on healthcare, including using virtual or plastic Visa cards or MasterCards that have the 4-digit merchant category codes, so they must be spent on medical care. Almost nobody with that ACA, less than 10%, will ever meet their deductible. It's so high. So they have insurance for catastrophe, but 99 out of 100 of them just needed care. So give them the care, give them the money. You say, well, what about the catastrophe? This goes back to what I said, the good part of the ACA. $40 billion is how much nonprofit hospitals benefit by their nonprofit tax strategy. Now, me and you know, they're the wealthiest. They got the prettiest water fountains, the greatest sports suites that invite you to the game. They should take 10 or 20 billion of that as the government demands, and they have to give back free and discounted care. 100 million people qualify for free and discounted care at nonprofit hospitals. So most of those that qualify for the subsidies, Chris, they're entitled to free care. And if you're in New York, you could be a family of 3 or 4 making 100 grand. You're entitled to free care. I repeat, free care at hospitals without insurance.
And let me tell you, charitable hospitals, as we used to call them, are a whole problem in their own. They call charitable care what they chase you down for, bankrupt you, and when you can't pay anymore, they write it off as charitable care. Doc, let's keep the conversation going as we see what they come up with on the government side. I appreciate your perspective.
Quite welcome.
All right, Dr. Bill Hennessy will speak again. 4 minutes and 15 seconds. You see, there are plenty of ideas. It's just about whether or not you have the will to try anything versus just blaming the other side. What do you think? Have your say. 844-968-7720. Remember the rule. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.